Prynawn da. Rwy'n falch i fod yma heddi i'ch diweddaru chi am y raglen frechu ar gyfer pobl ifanc a sut i ni'n gweithio i gadw dysgwyr yn ddiogel. Ac mae'n bleser i fod yma gyda'r athro Chris Jones, Dirprwy, Prif, Swyddog, Meddygol. It's a pleasure to be joined by Professor Chris Jones, the Deputy Chief Medical Officer. Yn gyntaf, mae'n ddiwrnod athrawon y byd a hoffwn i ddiolch yn fawr iawn i'r staff sy'n gweithio yn hysgolion, colegau a Phrifysgolion ledled Cymru am bopeth maen nhw'n ei wneud dros yr wythnosau diwetha ac rwy'n gwybod bod rhieni, gofalwyr a myfyrwyr yn ymwybodol iawn o'r ymdrechion aruthrol sy'n cael ei gwneud i gadw dysgwyr yn ddiogel ac i gadw nhw'n dysgu. On World Teachers' Day, I want to say a massive thank you to the staff working in our schools, colleges and universities across Wales for all they have done over the last few weeks. I know that parents and carers are aware of the tremendous efforts being made to keep learners safe and learning. In a moment, I'll explain some changes we will introduce to testing and self-isolation advice for young people and children. But first, I'll turn to Professor Jones.
Thank you, Minister. First, I would like to provide a picture of where we are with overall COVID-19 cases in Wales. Cases of coronavirus remain high in the community at the moment, at around 530 cases per 100,000 people per week. This is a fall, though, compared to 2 weeks ago, when there were around 650 cases per 100,000 population per week. The rates are currently highest amongst the under-25s, but fortunately we're not seeing infections in this age group translate into higher levels of serious illness, and we're not seeing evidence of infections being passed to older and more vulnerable adults. The second slide shows case rates for different ages amongst younger people, and I can point out some trends. As you will see, cases among the under-5s, the blue line, remain low. Among the 17 to 18-year-old age group, the red line, cases have fallen following an initial increase when we moved to alert level 0 on the 7th of August. The sharpest increase has been in the 12 to 16 age group, represented by the black line. In secondary schools, we have introduced asymptomatic testing. This means we find new cases and stop them spreading in our education settings. But it also means that young people are disproportionately shown to have positive cases compared to adult age groups. The more you test, the more cases you find. However, it is welcome that over the last week, the rate of rise of cases in this age group has slowed, indeed remained relatively stable. Finally, I'd like to confirm that our vaccination programme for 12 to 15-year-olds has also begun. We will have offered the vaccine to them all by the end of the October half term, 1st of November, with the majority of those who come forward able to be vaccinated in October.
Diolch yn fawr. I would now like to update you on the approach to self-isolation of under 18-year-olds. As we all know, young people are at the least risk of harm from the virus. We also know how important for their well-being it is for them to be in school, learning with their friends. Currently, under 18s do not need to self-isolate if they are a close contact of someone who is tested positive. This policy allows us to maximise learning for young people and recognises that evidence indicates that if someone in your home has COVID, only a minority of people will go on to catch it. But I also acknowledge that it has caused some uncertainty, so to provide further reassurance, students in secondary school or college who are a household contact will be advised to take daily lateral flow tests for 7 days. This will be in addition to the current advice for all close contacts to take a PCR test on day 2 and day 8. We would also still encourage all staff and secondary, college and university learners to continue with the twice-weekly lateral flow testing until at least half-term. In recognition of the specific challenges that special schools and colleges face, we've worked closely with the sector to see what further support we can provide. Today, we will be communicating specific changes, confirming that staff who are identified as a close contact will require a negative PCR test before they return to the workplace, followed by daily lateral flow testing for 10 days. This means staff will operate in a testing regime similar to health and social care settings. As Professor Jones has said, cases among the under 5s remain low. The benefits of testing children under 5 has been reviewed by our Testing Clinical Advisory and Prioritisation Group, who have advised that there's a limited benefit in widespread testing of under 5s, and particularly asymptomatic testing of close contacts. We are also conscious of how difficult obtaining a sufficient sample can be for parents and for carers. Therefore, I can confirm that we will no longer recommend that children under 5 take COVID-19 tests if they are without symptoms. If they do have symptoms, unless they're asked to do so by a doctor or if their parent or carer believes a test is absolutely necessary and in the best interests of the child. In higher education, cases are low at the moment, with very few cases reported over the last week, and this is obviously reassuring. Our universities have worked with local health boards to get pop-up vaccination centres on campus and to make it as easy as possible for students to get their vaccine. And I would encourage anyone who hasn't yet received their vaccine to get vaccinated. Looking forward, later this week, the Cabinet will hold its 3-week review of the coronavirus regulations, and the First Minister will be here on Friday to speak on the outcome of that review. I'll now take questions from our colleagues in the media. As usual, our answers will be available on the Welsh Government's social media channels. A ga I ddechrau gyda Cemlyn Davies o BBC Cymru.
Diolch, and I'd be grateful if you could answer these questions in both Welsh and English, please, Minister. Starting with the announcement that you've just made on advising secondary school students and college students to take daily lateral flow tests for 7 days if they're household contacts of someone who has been found to have COVID-19. Can I ask, is that advice coming into force immediately? And also, given that it is just advice, do you think that it goes far enough and will be enough to reassure those people who do have concerns around this?
Well, the first thing to say is I do recognise that perhaps this guidance is counterintuitive to some, and perhaps there's been some uncertainty in their minds around why this is the guidance. As I mentioned in my remarks, there may be a kind of common sense assumption that if you share the home with somebody, you're going to catch COVID if they're a positive case. What we know so far is that that is true in a minority of cases, and so we've been attaching a significant priority, as you know, to making sure that children and young people can be in school. With regard to the new lateral flow test regime, we are clear that people want to do the right thing. And what this will provide parents and carers and learners with is a daily snapshot of the position, which enables them to make the right judgments. That will come into force from Monday of next week, Monday the 11th of October. I ni'n gwbl glir bod angen fod yn cyfathrebu mewn ffordd syml gyda pobl ynglyn â hyn. A mae rhyw elfen o ansicrwydd wedi bod ynglyn â beth yw pwrpas y rheol fel sydd wedi bod ar hyn o bryd. Mae'r cynllun newydd o ganiatáu o ofyn i bobl gymryd prawf lateral flow yn ddyddiol yn galluogi rhieni, gofalwyr a dysgwyr i wybod yn ddyddiol beth yw eu statws nhw. Y bwriad yw bydd hyn yn dechrau wythnos nesaf, ddilyn nesaf, a mae'n caniatáu ac yn cefnogi i unigolion wneud y penderfyniadau iawn.
Diolch. And moving to COVID passes, and there'll be a vote on this in the Senedd later. Earlier this year, the First Minister talked about introducing an app which people would be able to use to show their vaccine status. Can you confirm that those plans for an app have now been shelved? And if so, how are you making sure that this process is as easy as possible, or as easy as it can be, for people to be able to prove their vaccine status?
Well, it will be straightforward. It's a digital offering, so whether you call that an app or a digital offer, I think is, perhaps a point of detail. The key point is it's available digitally for people to be able to show their status, so it'll be convenient. It's one of, I should say, one of a range of interventions that we have in order to keep people as safe as possible, and I think the COVID pass will have an important role to play in that. P'un bod chi'n galw'r pass COVID yn app neu yn declyn digidol, falle mae cwestiwn o fanylion yw hynny, fydd e'n sicr ar gael yn digidol, bydd e'n hwylus i ddefnyddio. Mae'n un o ystod o bethau ni'n wneud mwyn sicrhau bod pobl mor ddiogel a gallen nhw fod, ac mae'n bwysig felly bod hwn fel bydd yn hwylus i bobl allu defnyddio. Carol Green from ITV Wales, please.
Hello. Given the rates, is there a need for an autumn fire break, or can you rule that out today?
Yeah, there are no plans for a fire break. The First Minister will be giving the overall picture, of course, on Friday as a consequence of this review period, but there are no plans for a fire break. In terms of the transmission rates generally, obviously we've seen the picture that we've seen over the last few weeks, but we've heard today from Professor Jones where those figures are, and I'm very hopeful that we will see a pattern emerging which is much more positive in the coming weeks.
Turning to those rates amongst the 12 to 16-year-old group, should they have been offered the vaccine earlier? And also, what's the thinking around exams at the moment, given young people are missing so much school? What compensation will there be? Will we be back to exams or assessments?
Well, on the question of rates, I might ask Professor Jones to come in on that, and then I'll answer the question on assessments for next summer.
I mean, throughout the pandemic, we, along with the other UK countries, have followed the advice of the JCVI, and the JCVI took some time to consider the situation for 12 to 15-year-olds, looking at the international evidence which gathered from a number of countries over a number of months. And you'll know that after the JCVI concluded that there was a benefit from vaccination, that in purely medical terms, that wasn't sufficient for wide recommendation. Then the chief medical officers considered the issue in a wider sense, looking at the educational and mental health impact of COVID and the relative benefits of vaccination. So the chief medical officers undertook their work very quickly, working with the Royal Colleges and other professional advisory groups, and made the recommendation that they did, and we're rolling out the vaccination programme as quickly as we can. But we are dependent on advice from the JCVI.
In relation to the question on assessment over the course of the coming year, in the summer months, in the summer term, Qualifications Wales and the WJC clarified the position with regards to next summer, which is an exam series, and the WJC have confirmed the adjusted course content for those qualifications. You will have seen last week a statement in England from the DFE and Ofqual in relation to a consultation on contingency planning in England, and we expect this week for Qualifications Wales to be making a statement in relation to the contingency arrangements which would apply in Wales if it were to be the case that exams couldn't be run. What I would say is that in order to enable students, in order to minimise the disruption to students who are facing exams, we've invested very, very significantly into the digital offer, whether that's electronic kit, whether it's around professional learning for the teaching workforce, whether it's about online resources. And so I think we're in a very different position at the start of this school year than we were last year. And I very much hope that despite the challenges that some schools are facing at the moment, we'll be able to minimise the disruption to students in their qualification years. But there is, I think, significant funding in the system to be able to support that cohort of students as they embark on this school year.
Yeah.
Abby Whittick from Wales Online.
Good afternoon, Minister. Just returning to lateral flow tests for secondary and college learners where a household member tests positive. Last week, obviously, you said it was perfectly safe for them to return, and you repeated that several times to me and elsewhere. Why not make this compulsory if it's now needed? And also, why not extend it to primary school age children where a household member tests positive for COVID?
I think in relation to the latter point, for primary school children, the experience of lateral flow testing has been, I think, less straightforward than it is for secondary school pupils. I think in relation to the advice on lateral flow testing, I mean, it will be an expectation. We are asking pupils to take these tests in order that they have a daily picture, in addition to the existing requirements around PCR tests at day 2 and day 8. Our experience is that people want to make the right choices in this situation, and that's why we've approached it in the way that we have.
Sorry, but just to press you, but why not make it compulsory if this is really a necessary thing to make schools safer, which heads have been asking for? Why not make it a compulsory thing to do before returning?
This is in order to provide reassurance, because the existing policy perhaps has been not well understood, and so we want to be very clear that this provides reassurance to parents and learners of the status of individuals. Just on the question of schools being safe, I just want to be clear about this. The underlying policy remains the case that you are able to go to school in the context that I've described, because as I mentioned in my initial remarks, whereas people may assume that because you're sharing a home with someone who's a positive case, you're guaranteed to become infected with COVID yourself. That isn't the picture that we currently understand it. And so the underlying policy isn't changing, but we're providing additional reassurance to parents and learners by introducing the new lateral flow test regime.
Thank you. Also, heads are saying that this term has actually been more disrupted than any other term during the pandemic. They've had more children off, more staff absent. There's a shortage of supply teachers. Obviously, thousands of children have been sent home to learn remotely again. Are you confident that they are getting the education they need, both when they're in school with teachers absent and when they're remote learning? And how are you keeping an eye on that with education inspections from Estin suspended, full inspections suspended? Who's keeping an eye on that, and how are you monitoring that? And are you confident that our learners are getting the education that they need at this time with all this continuing disruption?
Well, on the question of Estin, as you will know, the suspension of the core programme is in place for this term, but that will gradually increase over the course of the school year. I want to be very clear, as I was in my opening remarks, that I know that schools will be facing significant challenges in some instances because of staff shortages as a consequence of the level of community transmission which exists beyond the school, and that will pose particular challenges to some heads in timetabling and so on. I also think that, as I mentioned briefly earlier, we are in a very different place now in relation to the support we're able to offer students when, despite everyone's best efforts, they aren't able to be in the classroom. So whether that's blended learning resources, whether it's support for teachers, whether it's about particular resources available to that cohort of students studying for examinations, in each of those areas, I think we've invested very significantly as a government and as an education system. And I think the offer now is a much richer offer than it was able to be at the beginning of the pandemic. So I know that teachers and learners are doing absolutely everything they can to keep learners in school, getting the education they need and deserve in the classroom. But I don't underestimate the challenges that some schools are facing. And finally, Dan Bevan from LBC, please.
Thank you, Minister, and to yourself, Dr. Jones, as well. Good afternoon to you both. If I could move back to vaccine passports. Firstly, to yourself, Minister, do you believe that you've got the support in the Senedd in order to get this proposal through? And a question to the both of you, do you believe, or how do you believe, that vaccine passports can stop the spread of COVID-19?
Well, Dan, the first thing to say is it is not a vaccine passport. So it is important that people understand that this is a COVID pass. It is a pass which already operates, it already exists, and it isn't guided simply by your vaccine status. It also allows, for example, lateral flow test results to be taken into account. So I very much hope that the vote will be won in the Senedd this afternoon, because I think it's an important contribution as part of a broader range of measures to how we tackle COVID transmission in our communities. Professor Jones.
Yes, thank you, Minister. I mean, we've known throughout the pandemic that large gatherings of people represent the highest risk environments, and that secondary transmission can be higher in events than in other settings. So we are keen, as the Minister said, this is part of a wide range of measures which are being deployed at many levels across society. We are keen to try to minimise the risk of these events while enabling them to continue, so life can return to normal with some degree of protection. So I think in terms of protecting us against super spreader events that we saw earlier in the pandemic, you know, this policy has an important part to play.
Thank you. And to yourself again, Professor Jones, apologies for the motion, by the way. The cases are down at the moment, and hospitalisations, of course, are at the lowest that we've seen in a couple of weeks. I mean, do you think that we have reached the peak of the third wave now, or is that still to come?
I think I would hesitate to say publicly that we have reached the peak, but we do know from the modelling that there should be a peak before a decline in cases. And I have to say we are encouraged this week by the reduction in cases we've seen over the weekend. You know, the reduction over the weekend has been more than we may have expected, so that is encouraging. But I think it is too early to say that we're through the worst of this. The data from hospitals also has been a source of some reassurance. We still have nearly 600 people in Welsh hospitals with COVID-related problems, but it is true that that number has decreased over the last week or two. So overall, the evidence seems to be that the incident case rates and the harm that follows are both going in the right direction.
Dan, thank you very much. Diolch yn fawr iawn.